These people want to make profits at the expense of our lives.
Nigeria is grappling with a growing public health emergency, a silent epidemic driven by unchecked consumption of sugar-sweetened beverages, SSBs, popularly known as soft drinks. These products, often marketed as harmless refreshers, are fueling a deadly surge in non-communicable diseases, NCDs, such as diabetes, hypertension, stroke, and heart disease. At these roundtable media engagements, these public health experts are calling for an increase in SSB tax to at least 130 naira per litre. This, they say, will save lives, reduce health costs, and generate revenue to fund healthcare, education, and nutrition.
Non-communicable diseases are complex, they are difficult to treat, they take monies out of pockets and push people into poverty, and to a large extent they are lifelong. So they are not easily treatable, they are not easily curable like infectious diseases. So I mean, if you can, we are saying, control the excesses of the mouth to live a longer and healthier life, I don't think that's too much to ask for.
Many people that are suffering from infertility, people married, they are unable to have children. It's as a result of SSBs in their blood. When it is in their blood, they won't be able to produce mature sperm, and the woman will not be able to produce mature eggs. And when these two mix together, they will say, I have seen my menses again. It's because SSBs. It is a big problem.
The World Health Organization (WHO) reports show that NCDs now account for 1 in every 3 deaths in Nigeria. Despite this growing toll, government efforts to curb consumption remain weak.
Because a lot of the time it takes our government a whole of all of us coming to do what will benefit us. So we think that the industry used to deceive our government from taking actions that will benefit the Nigerian people.
There are countries who have advanced in SSB tax implementation, and you have to have advanced in effective SSB tax implementation to carry out an evaluation. So these countries that I mentioned, Mexico, Peru, South Africa, United States, they have advanced in the implementation of their SSB tax or SSB related taxes. And so they've carried out these evaluations, and based on industry claims of job losses, a number of them, all of them to be honest, have actually found out that there was no reported job loss. There was no reported job loss, there was no reported loss in wages, and there was no reported loss in even profits, so in Nigeria there's also need for researchers to carry out such evaluations, true independent evaluations free from conflict of interest, to truly determine first of all, how many Nigerians are being employed by these private sectors, food and beverage industries, how many of them actually fully employed, and based on that and based on the current SSB tax rate, how many of them have lost their jobs? Was it because of inflation in the country, or was it because of the SSB tax? So there's need for an evaluation, a detailed evaluation on the impacts of SSB tax in relation to job loss. But my presentation was really to show, based on industry claims, there hasn't been, any known unbiased, job losses across the globe because of SSB tax, even regardless of the rates.
Advocates at this event, organized by the Corporate Accountability and Public Participation Africa (CAPA), insist that the current 10 naira per litre excise duty on sugary drinks is ineffective, as it has failed to discourage purchase or influence industrial reforms for safer alternatives. All from Stephen, STN News.